Good day, everyone. So today's agenda is we're going to perform the head to toe assessment. And when you are going to perform the head to toe assessment, of course, we must follow the sequence on how to assess of each system. So first, we must inspect, palpate, percuss, and auscultate. Then, when you are assessing the abdomen, it's gonna change a little bit. So first, we must inspect, auscultate, then percuss and palpate. We must perform hand hygiene and provide privacy for the patient. Hello, my name is Quimby Maria S. Samar and I am your nurse for today. And I need to perform the head to toe assessment. Is that okay with you? So say your first name and last name
Janelle Sweet,
and your date of birth.
November 20,
Okay, do you want me to call you Janelle or what do you prefer?
Janelle.
So you can tell me where you are at.
Easy Med Training,
Can you tell me what you're doing, what we are doing here today?
Physical Head Photo Assessment.
She answered all those correctly and she's alert and oriented. We will collect the height and the weight of the patient and then we will look at the BMI. So we will collect the vital signs, the TPR-BP, the temperature, pulse rate, respiratory rate, and the blood pressure. So first, we will check her temperature. So we will use thermometer. So your temperature is 34.7. And we will check her blood pressure. So your blood pressure is 110 over 75. So are you having any pain on a scale from 0 to 10? 0 being no pain at all and 10 is the worst pain you've ever had.
Zero.
So can you close your eyes tightly and open them up? Smile for me. Frown. Smile with teeth. Pop out your cheeks. So the cranial nerve is intact. So I will inspect your head. We will now palpate your head. So now I will palpate your temporal artery. Then your TMJ. Can you open your mouth for me? Close. Close. Palpate the maxillary sinuses. And now I will be assessing your eyes. I will pull down your eyelids, up and down. Then I will use this pen light. Follow this pen light using only your eyes.
I'm going to assess the ears of my patient. And first, I need to check his ears first,
Then I will check
both
your
ears.
eyes.
And then next, I need to palpate his carotid artery.
So to test the vision, we need to use the Snellen chart. So can you read it?
E, F, P, P, O, C, L, P, E, D, P, E, C, F, D, E, D, F, C, C, P, F, E, L, O, P, C, D, B, E, F, P, O, T, E, C.
So your vision is 20/20, then it's normal. Next, I will be assessing the ears.
Next is,
First, I will inspect the ears.
next is I will be
So ears are symmetrical. Then I will palpate the carotid artery.
patient and hear the words that I said.
Then I will use the tuning fork to test if you can hear the vibration or sounds. So tell me if you can hear it or not.
Okay, next, I will be going to whisper both my ears to my patient to know that my patient can hear the words that I said.
The next will be
Okay, done. So patient can hear the words that I said.
U, C.
then I will check your ears using the otoscope. Sunod. Oh, that cranial nerve is intact. Now I will be assessing your nose. So first, I will use the pen light to check your nose if there is any abnormalities. No. Then after that, I will palpate the maxillary sinuses. Then, can you hold your right side of your nose? Then breathe in, breathe out. Then left, breathe in, breathe out. So, can you close your eyes and determine what smell is this? So, first, vinegar. Second, sugar. Last, Apple. So great. So that cranial nerve is intact. So next I will be assessing the mouth. So first I will use the pen light to inspect the mouth if there is any abnormalities.
One. One.
Say ah.
Two. Three. Four.
Then let your tongue out. Move up, down, left, right. Then I will use the sterile wooden tongue depressor to check them out if there is any abnormalities. So next, I will let my patient to close their eyes to determine if what smell is this. Taste, I mean, is this. So first, salt. Second, sugar. Then lastly, vinegar. So great. So the cranial nerve is intact. Now moving on to the neck, so what we're going to do is we're going to inspect the neck first. So you're going to have the patient extend the neck up a little bit and you're looking at the trachea. Is it midline? And look for any lesions or any lumps. Like what you might see in thyroid problems like a goiter, and we don't see any of that. Then we're going to do is we're going to test cranial nerve 11, which is the accessory nerve. Move your head side to side, up and down, then shrug against my resistance. And he does that with ease so the nerve is intact. Then we're going to place him at 45-degree angle and we're going to have him turn his head to the side, and what we're looking at is the jugular vein. We're looking for any jugular vein distension. So I'm going to turn your head to the side like that. So we're looking for any distension of the vein and we don't see any. Next, we're going to palpate. So we're going to palpate the trachea just to confirm it is midline. So palpate lymph nodes, ask patient if she feels any tenderness, lumps, or any inflamed nodes. Turn patient into your side, then palpate nodes start in the pre-auricular and front of the ears. Then palpate posterior auricular, back of the ears. Then occipital node. After that, the parotid gland. Then palpate jugular digastric. Then mandibular. Palpate submental, superficial cervical, then proceed palpation into the deep cervical chain. Then palpate posterior cervical and palpate right above the clavicle, the supraclavicular. Then check for any abnormalities such as tenderness. Now we're gonna palpate the carotid artery, and this is one artery that you did not palpate bilaterally and you do one individually. So we're gonna feel on this side and you're gonna find it next to where the groove of the neck and next to the trachea. And this is nice and bounding. Then we're just going to feel on the other side and same strength. And finally, we'll auscultate the carotid artery and you'll do one side at a time. Compare sides and listen to the bell of your stethoscope for a bruit, which is a swishing sound. So I'm going to have you breathe in, breath out, and hold it for me, okay? Go. Breathe in and breath out, okay? Then assess that, then palpate. And what we're going to do is palpate our post or radial artery. So feel those bilaterally and they are 2 plus and equal. Then check capillary refill, which we'll do by pressing down on that nail bed and seeing how fast it comes back in, which should be less than 2 seconds. Then check skin turgor, which we'll do by pressing down on the nail bed and seeing how fast it comes back in, which should be less than bobbit. That's correct. Turn the film bobbits on the pinch. Just a side note, if there were a dialysis patient with an AV fistula, you want to palpate it and feel for the thrill. Make sure it's present in that arm wherever the fistula is, and then you don't want to test the muscle strength. So I'm going to have you squeeze my fingers as hard as you can, okay? So that's really good. Then place your palm behind the elbow and move the arm to see whether you can detect any grading crepitus in those joints. Then you can feel it and move it bilaterally if you have arthritis. Checking for a drip with the upper extremities is another thing to do. Hold out the patient's arm and close their eyes for around 10 seconds. And you're done. So we will inspect the chest and look for any abnormalities, lesions, wounds, then inspect effort of breathing, really labor or using accessory muscles to breathe. Then look at the anterior and posterior diameter, the barrel chest, COPD. Then listen to heart. Auscultate heart sounds and publications. APETM, based on valves. Diaphragm. First the aortic, the S2 louder. Then pulmonic valve, dub louder. Herbs point, third ICS. Tricuspid, fourth ICS, the loudest S1. Then mitral valve, the clavicular line, louder S1, point of maximal impulse apical pulse to 60 to 100 BPM. Then use the bell and repeat aortic, mitral to listen for heart murmurs, swishing, and blowing. Now we will listen for the lung sounds. So listen for abnormal sounds. Let the patient take a deep breath and auscultate the apex of the lungs after, one side at a time. Breathe and then auscultate. Repeat diaphragm right to left. Then second ICS is to assess left and right upper lobe. Breathe in, breath out. While auscultating, repeat right to left. Fourth, ICS, location of middle and left upper lobe. Breathe in, breathe out. While auscultating, repeat left to right. Then mid axillary, 6 ICS, left to right. Then the posterior, lungs apex, left to right. Vertebral prominence, big ball of the nape to T3 between the shoulder blade and the spine, right to left. Assess right and left upper lobes. Then a T3 to T10, right and left lower lobes, left to right. And now we're going to assess the abdomen. And remember, we're switching the sequence and how we assess. We're going to do inspection, auscultation, percussion, or palpation. So we're going to do auscultation. So whenever you're looking for assessing the abdomen, you have to let the patient lay on their back, and we're going to do is we're going to inspect the abdomen. First, we want to ask RG, are you having a stomach issue at all? When was your last bowel movement? How are you urinating? Do you have any pail while you are peeing? Do you have problems starting a stream? Any discharge or anything like that? With your male patients, you want to ask about the due to prostate enlargement and we are starting a stream. And if it is a female, I would ask her last menstrual period was, and also ask again about urinating and things like that. Now, if the patient had Foley, this is the time you would want to look at the urine, inspect the Foley, and look at that. Just conglomerate your urinary system and your GI system together. We are inspecting the abdomen. We're looking at the abdominal contour. And this patient is scaphoid. It goes in a little bit, but you can also have flat around it or protuberant. And also, we're going to know if there is any pulsations. A lot of time in this area, right here in thin patients like with RG, I can see that aortic pulsation. This patient's right above the umbilicus and looking at the belly button and checking for any masses. Do we see any hernias or anything like that? Also, if your patient has any wounds, you wouldn't look at that. And if they have a PEG tube, you wouldn't want to assess the site. Make sure it's not red and ask them how it feels. And when you're ostomist, you want to look at the stomach and make it is a rosy pink color. If it's not a dusky cyanic color, and it's not prolapse, and look and see what type of stool it's putting out. And note the smell, note if the bag needed to be changed, anything like that. So now we're ready to listen to bowel sounds. And what we're going to do is we're going to listen to the diaphragm of our stethoscope. And we're going to start in the right lower quadrant and work our way clockwise. And we're going to listen all four quadrants. And you should have here 5 to 30 sounds per minute. And if you didn't hear any vowel sounds, you need to listen for 5 full minutes. Note, these are normal and they hyperactive or hypoactive? So let's listen. This is our right lower quadrant, so we're gonna move out to the right upper quadrant and move over to the left upper quadrant and then down to the left lower quadrant. And now we're going to assess the lower extremities. So first of all, we're gonna do is we're going to inspect. We're gonna look at the color from the legs to the toes, making sure it's nice and pink. And here we see that being has a little bit of a tan line here, and we're looking at the hair growth. As well, you want to make sure there's normal hair growth because of PVD. You will see hairless, shiny, thin legs. And here we have excellent hair growth. And also, do you see any abnormal swelling? Just right off the bat, before you've even touched the patient and look at the legs and the feet for any swelling redness. So, do you have any pain or in your legs, anything like that? We'll ask the patient that. And looking at the joints, make sure there's no redness on in the joints because a lot of times with gout, it likes to start out in a big toe. So make sure that everything looks good. And then on your diabetic patients, make sure you look at the bottoms of their feet because these patients don't have the best feeling in their feet. So their shoes could be wearing on them or they kind of step on something and not even know it. So inspect those feet and make sure there's no ulcers or anything that needs to be addressed. Also, look at the two nails. So the two nails look healthy, or is there fungus or the missing two nails? They have a really bad ingrown two nails. Assess for that. Next, you want to palpate your pulses. So palpate the popliteal pulses, which are behind the knee, and those are about 2 plus. They are equally bilaterally. I'm just feeling his legs, they're nice and warm, and I'm going to push over his tibia firmly and I'm seeing if there's any edema. So push there and there's an edema. A lot of times when you push down, it's like this hard like type gel. They'll just separate and your finger will leave this indentation. So in here we don't have any. Now we're going to palpate in the feet and we're gonna feel on the pulses. I'm gonna don gloves, perform hand hygiene, don gloves. So we're gonna feel on the pulses in his feet and we're gonna feel on this posterior tibial. 2 plus really good. And then we're gonna feel the dorsalis pedis, which is on top of the foot 2 plus with that. And if you can ever find this, because sometimes these are hard to find in patients, you can get a Doppler if you have one on your floor. Next, we want to check the capillary refill in his tooth, just like how we did with the fingers by pushing down in less than 2 seconds. Check the other one. Okay, now I'm going to have him push against my hand. So push against my hands. Okay, good job. Now I'm gonna have you raise your legs against resistance. So we're gonna check the Babinski reflex, and you can use your reflex hammer for this and use the end of it. Or you can use your finger if you don't have that. And what we're gonna do is we're going to take this up through the ball of the foot and curve it, and we're looking for the toes to curl. It would be a negative normal response. So let's check that, okay? And that was normal. Then we're gonna do our gloves and perform hand hygiene.